Welcome back. Thank you for staying with us. Now, in the past 3 years alone, Africa has seen its share of infectious diseases. From COVID to cholera, measles to malaria, cases have been on the rise, leading to a loss of human life. International SOS experts are observing a change in the pattern of outbreaks, which are also affecting areas that were free of these health threats before. Concerns around misinformation, symptoms and prevention are also on the rise. And joining me now to address those concerns is Dr. Chris Van Straten from the International SOS. Doc, thank you very much for your time here on eNCA. Just first of all, what kind of symptoms should we look out for, especially just ordinary people in Africa, but also businesses operating here?
Hey, good afternoon. Thanks for inviting me on the show. So, excellent question. Let's start with malaria, because we've just seen so much of it in the last couple of months. And especially if you remember reports coming out of the last 6 months to 2 months. Northern provinces, Kruger Park, KZN, Limpopo, we've seen much higher cases of malaria than the previous years. And we've also seen it through the winter months because of the warmer periods and the rain that's been falling. Now, the symptoms and signs of malaria can be a lot like other infections, and that can make it dangerous. So often patients will present saying, "Doctor, I've got a cracking headache. I've had this horrible fever at the same time every night. I feel fatigued and my joints are aching." And here's the thing, we know that COVID can make you feel like that. We know that flu can make you feel like that, and also tick-bite fever. So it's really important for doctors to consider, and we always ask, where have you been traveling? Is there any possibility that you might have been exposed? And if we think there's a chance, we need to test for it and exclude it, because if you don't, it can and will kill you. Hope that's useful.
And Doc, you say in your statement that you've seen a change in outbreak of infectious diseases in Africa. How much has COVID, contributed to this? Is it a case of the fact that because of COVID and how many people died at a time during that outbreak, people are getting more scared and therefore are going to doctors instead of treating at home, and therefore you see the soaring number of infections? Or did COVID itself just change the way that people get sick?
That's a really good and clever question. So let me give you some of the history. If you think before the COVID pandemic, me and many other doctors around the world were proud that we were seeing, for example, infections of tuberculosis, either stable or improving. The case numbers were decreasing, the deaths were decreasing. The same with malaria in many parts of Africa. Then the COVID pandemic struck, and it had multiple effects on multiple levels. The first level is that people they were locked down. So if you got sick and you were coughing for weeks, many people, because they went locked down, because they were scared of getting COVID, didn't go seek healthcare. The other aspect is that many healthcare facilities, which were stretched before the pandemic, were stretched to their limits. So even if you got to the hospital, because the wards were overwhelmed with COVID patients, they might not have had time or been able to do the right TB testing or look for malaria and many of these other infectious diseases. And that's played a role. And then the economic impact. Many people have suffered very heavily from the impacts of COVID, either losing the breadwinner in the family or the impact of the lockdowns and people not being able to get to healthcare or afford the healthcare that they need and deserve. So I think it's a complex mix of all those. And we've seen the spike in malaria cases, tuberculosis, and even diseases like cancer, which are not necessarily infection related, just because people haven't been able to get to the healthcare facilities or scared to go because they might get other infections. I hope that helps explain a bit.
It does. So what kind of treatment do we look for in order to make sure that we prevent ourselves from getting diseases such as malaria?
Great. I love that question. Now, this is also really complex because we're all different, right? Different people need different messages. Sometimes you need to repeat the message. We are really passionate about this. So I love the fact that you've had the show today and that you've invited someone like me with a passion for educating people and reaching out. And we need to continue that, and we need to strengthen that in our different communities. The other important role that we all play is watch what you do, your hygiene, where you wash your hands. If you take these little steps, you protect not only yourself but other people. And so we must keep educating. And then specifically for malaria, we know that the patterns are changing. We know that the Anopheles mosquito, that's the mosquito that carries especially the dangerous form of malaria, falciparum. It's moving further south because of the warm, wet, longer periods. And there we can make sure that you're protecting yourself. If you're traveling in a malaria area, take your prophylaxis. They are very effective. Make sure you wear the mosquito net. And the new mosquito nets they're impregnated with mosquito repellents. And then wear long shorts, long pants, long shirt, and avoid the time that the mosquitoes come out, which is dusk to dawn. So there's lots of little things we can do. And we've been assisting big companies that operate in malaria areas to track the mosquitoes, to spray, to prevent the places where they breed, and in that way, making sure more people are healthy and not getting very sick. Thank you very much.
All right, just lastly and very quickly, Doc, in terms of your concern about misinformation, which sources do we trust then as, people who are trying to stay clear of these infectious diseases?
Absolutely. Lovely question. So number one, the WHO, the World Health Organization, has got an incredible library of information on all major countries. And you can and will find updated information on these infectious diseases like malaria, measles, Ebola that we saw in the DRC in Kenya, dengue in other parts of the world. So WHO is one. The Africa CDCs is really going from strength to strength and growing its ability to track, monitor, and get different governments to cooperate in terms of sharing data and battling these infectious diseases. And then another source in South Africa, our NICD, that's our National Institute of Communicable Diseases, is pretty on the money. They're good, they're tracking it. And of course, our company, International SOS.
All right, Doc, thank you so much for your time. That was Dr. Chris Van Straten from International SOS.